and continue looking at pretty pictures. And make sure that we just have another chance to continue to kind of solidify this knowledge we have. Yeah? Yeah. So I am presenting my screen, but I'm not going to ask you about this first slide yet. I'm going to ask you some other stuff just to kind of get back on track where we're at, okay? So Miss Bilotic, what are the names of the 4 quadricep muscles?
The rectus femoris, sorry, I'm blanking out.
No, you actually already got the hardest one, rectus femoris. So there's 3 ones with the word vastus in them.
Oh, vastus medialis, vastus intermedius, and then vastus lateralis.
That was absolutely fantastic. Thank you, ma'am. Mr. Kandaris, what are the names of the 4 quadricep muscles?
Rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis.
That's perfect, sir. Thank you. What quadrants or what compartments on the leg do they live? You've got an anterior, posterior, medial, and lateral compartments on the leg. Where do we find these 4 muscles as a group?
And on the anterior side of the leg.
That is correct. Give me more.
Well, I mean, it's kind of like you said it. You got one medial laterally and anterior, but you got 2 anterior. Is that what you're looking for?
So, I'm looking for this. The quads live on the anterior, you're absolutely right, and lateral compartment of the leg. They make the front of the leg and the side of the leg.
Yeah.
Cool. So anterior and lateral, that's all. You did great.
Okay, yeah, because the medial
The medial isn't medial, it's still anterior, it's just the most medial of those. Yeah.
Yeah.
Cool. But the vastus lateralis is truly on the lateral side of the leg. So the quads are found on the front and side of the leg. And that's important to us as massage therapists, that when we're rubbing a side of the leg, the reason I make such a big deal out of this, when you're rubbing the top of a leg, you're rubbing the quads, and when you're rubbing the side of a leg, you're rubbing the quads. You know, we need to know where stuff is. That's why I mentioned these compartments. That's awesome. Thank you. Miss Felix Osuna.
Yes.
What's the name of the 4 quads?
Rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis.
Thank you so much, ma'am. What compartments of the leg can they be found on?
They're in the anterior side, lateral.
Thank you. Anterior and lateral compartments. Awesome. And what action do all 4 quads create?
They extend the leg.
Yep, they extend the knee. Boom. Kick your leg out for like kicking a soccer ball. Cool. And what 2 actions does the rectus femoris create?
Was it flex the knee too?
Extend the knee.
Extend the knee. And flex the hip.
And flex the hip. Yes. And because it can flex the hip, what do we call it when the hip bends forward?
Tilt? Is it tilt?
It is. What type of tilt is it?
Forward?
Anterior tilt?
Anterior.
So the rectus femoris can create an anterior tilt. Thank you very much. That was awesome.
No problem, thank you.
Miss Stanley. Miss Stanley. What compartment of the leg do the hamstrings live in?
Like posterior?
Yes, exactly right. Posterior compartment of the leg. How many hamstrings do you have?
4?
That's actually not a bad answer, but 3 technically with 4 heads, right?
Okay.
What are the names of the 3 hamstrings?
Biceps femoris, semitendinosus, and semimembranosus.
Great. Which ones are found on kind of the medial, which one's attached to the medial side of the knee?
Semimembranosus and semitendinosus.
Beautifully done, thank you. Which one's attached to the lateral side of the knee?
Biceps femoris.
Thank you, really well done. Which ones have origins on the hip, on the ischial tuberosity of the hip?
Don't they all?
Kind of, yes. But if you tell me which heads have origins on the hip.
The long head
Long head of what?
of the bicep femoris.
That is correct.
Semitendinosus
That is correct.
and semimembranosus.
That is correct. And the short head does
Just the
not. The short head only hooks to the femur. Really well done. Thank you, ma'am. That was good. It's hard stuff. Miss Nguyen,
Yeah.
what is the name of the 4 quadriceps femoris muscles?
Rector for
You did great.
femoral.
Yep, rectus femoris. Yes.
Yeah, and vastus medialis,
That was really good. Vastus medialis. Sorry, I cut you off.
and vastus lateralis.
Yeah, vastus lateralis. That was great.
Deal.
Yep, and I'm sorry, I cut you off. What was the last one?
Vastus intermedius.
Vastus intermedius. Oh my God, that was fantastic. Rectus femoris, vastus medialis, vastus lateralis, vastus intermedius. What are the name of the 3 hamstrings?
3 hamstring have bicep femoris and semitendinosus and semimembranosus.
Sorry, I just got to bask in your amazingness right now. Just going to take it in. I am not making fun of you. I am complimenting you. Semimembranosus is how you say the word. Thank you very much. You should teach hamstrings. That was good.
No, thank you. Thank you because you did me every day. I so to try and meet the bar. He tell me the how to in the real muscle.
Yeah, cool.
Yeah.
All right, I got one last hard question for you. Will you tell me the 5 adductor muscles? These are found in the medial compartment of the leg, the 5 adductor muscles.
Adductor mangus. Adductor longus. Adductor brevis. And tractinus. Crash ilis.
Thank you, Miss Nguyen. I'm going to repeat those just for clarity, just so you can hear it, but those were really clear. And I like how you say adductor, essentially, because that's actually how most massage therapists talk. They don't actually say adductor. They say adductor because it's so hard to hear the difference. Adductor magnus, adductor longus, adductor brevis, pectineus, and gracilis. Beautifully, beautifully done. Thank you.
Yeah, thank you, sir.
Thank you. Miss Torres.
Yes.
Miss Torres,
Yes.
what is the name of your 3 erector spinae muscles?
Is spinalis, longissimus, and iliocostalis.
Beautiful. What is the name of your 3 erector spinae muscles from lateral to medial?
Iliocostalis, longissimus, and spinalis.
What is the name of your erector spinae muscle that inserts into the mastoid process of the temporal bone?
Longissimus.
Thank you. Thank you. It's been a pleasure talking to you. Awesome. Miss Harper.
Yes, sir.
Miss Harper, what is this muscle up here in the picture here?
Is this sorry.
That's okay.
Is it splenius?
It is a splenius.
Capitis? No.
Yep. Yes. Don't say no. It's going to the head. Splenius capitis. Say yes.
Capitis.
Splenius capitis. Thank you. What's this muscle?
This is the semi-spinalis capitis.
Yep. Semispinalis capitis. Beautiful. Thank you very much. Miss Hanson. What's this muscle?
Is that the splenius capitis?
It sure is. What's this muscle?
The semispinalis capitis?
Yes. I was waiting for the end. Thank you. What's this muscle?
The splenius capitis?
It's splenius capitis again, yes. What muscle group is this?
I don't remember.
That's okay. What, do you know what region that is?
It's in the cat.
Well, you're remembering some of the muscle names right now, but the whole muscle group. Most massage therapists don't actually know all the muscle names in here. There's 4 on each side. There's 8 total. So these are the occipitals or suboccipitals. They're underneath the
Occipitals?
they're underneath the occipital region. This is called your occipital region. This bone is called your occiput. This is the occipital region. I make such a big deal out of these. These essentially tie your head onto your neck, and they're essentially just filling this space of 2 fingers here. And you've got 8. I'm actually not going to ask you to name them, but they're called the suboccipitals. You guys will find that when you go to work at places next week that they don't know the name of all the suboccipitals. That would be unusual. They might. There might be somebody there, but I doubt it. But they will talk about the suboccipitals. Like, hopefully. Anyway, super important place. Remember I said yesterday I made a big deal about, like, client comes in with a hurt pinky, rub their suboccipitals. Right? Cool. Awesome. Thank you, ma'am. Miss Cooper. Hi, Miss Cooper. I watched your eyes. It looked like you were kind of drifting somewhere, so I thought I'd pull you back in. Hey, what muscle is this?
A neck muscle.
It is a neck muscle. Posterior neck muscle.
Is it an occiput something?
Nope, not a suboccipital. It's too big.
Huh?
It's too big to be a suboccipital.
So it's too big.
It kind of goes up part of the spine to the head. Kind of like semi part of the spine to the head.
Semisplenus capitis?
Semispinalis capitis.
Yeah.
That one. Cool. Semispinalis capitis. Good job. What's this muscle? So almost sounds the same, really. This goes from the spine to the head, from the spinous processes to the head.
Spinalis capitis?
Splenius capitis. Pretty
Okay.
good. Pretty close. All right. So what is this muscle group?
The occipitals?
Suboccipitals. Yes. Suboccipitals. Good. Suboccipitals. Let's stop right there. Thank you, ma'am. Miss Yanes? I've got a question for you about the suboccipitals that are in this picture. I do not need to know exact origins and insertions, but the suboccipitals kind of tie your head together with some vertebrae. Yeah? Hold on, I'm getting feedback from... Oh, maybe not. Okay.
No, I think it's my mom's kids upstairs.
Which is totally adorable. I just thought it was somebody in the background, like, kind of, and I'm like, oh, that's adorable. Okay.
Yeah.
So, and you're welcome to ask them for help if you need it.
Okay.
So the suboccipitals, it ties your head. It actually attaches to the occiput, this bone back here in your head, and it ties it down to the vertebrae. How many vertebrae do they connect to?
2.
2 is right. C1 and C2. Yeah, that's it. This is a muscle. I mean, some only go to C1, but the point is this whole group goes to from the head to C1 to C2, or from C1 to C2, or from C1 to the head. But it only deals with the head in C1 and C2. Thank you. It was a very confusing question, but that's the point I'm trying to make, which is why it takes up this much space, right? So when you see origin insertions for this group, it always is like, you know, superior and inferior nuchal lines and C1 and C2 stuff. Yeah, that's it. Cool. All right, that's what it does. Thank you, thank you, thank you. Miss Hunter, what muscle is this?
Trapezius.
Cool. Tell me the 35 actions of the trapezius, because there are about that many. Not that many, but I think there's like 5 or something. It's ridiculous. It's a horrible question.
It elevates the shoulders.
Upper fibers elevate the shoulders. Thank you.
And it assists the neck in doing the rotations, maybe?
It would actually. It would do extension and it would help with rotations of the neck with upper fibers again. Yeah. Thank you.
The lower fibers depress the scapula.
Thank you. Lower fibers depress the scapula.
I feel like it does something like assisting the erector spinae group or something because it's so close, but I don't know.
Actually, I don't think it does, but that's actually not a bad guess at all. You've by the way talked about the upper fibers helping with elevation, neck rotation, and neck extension. That's all upper fibers, right? You talked about the lower fibers depressing the shoulders. You didn't mention anything about the middle fibers.
Oh, middle fibers. Do they do something with the shoulders? Oh yes. Oh God, I always say internal rotation, but it's retraction.
Retraction. Thank you. You did so well that I want you to answer the bonus question of what is the other word I could have used besides retraction of the scapula?
Adduction.
Oh my gosh, Miss Hunter. It is a great day. It is a great day. All 8 cylinders are firing. You nailed it. It is adduction because the scapula is actually getting closer to the spine. Yeah. Do you guys remember 3 months ago when like you couldn't even kind of figure out, any of you couldn't kind of figure out adduction, retract, all that kind of stuff, and now you're putting together with muscles and everything? Fantastic. Thank you, ma'am. Thank you. You guys must have a very good teacher. That's all I can say. This is the erector spinae group, by the way. Should have had that earlier. It's the whole group. Miss Cooper. I know I already called on you, Miss Cooper, but I want to go back to you because I want to know what muscle this is.
Excuse me, Mr. T.
Hold on one second.
So many.
Hold on 1 second. Got somebody asking me something. Yes?
Have you seen Mr. Ybarra? Is he here this morning?
He is.
Okay. Can you tell me where to find him? No.
He's not in his office?
Oh, I haven't looked there.
Oh, he's not teaching right now, so I guess he'd be in his office.
Very well.
Is everything okay?
Oh, indeed it is.
Oh,
I
good.
just needed the number from the orthopedic
Oh.
specialist. Thank you.
Sorry, they were looking for Mr. Barr. And I'm like, did you look in his office? And they're like, oh, we didn't think about that. So what is it, Miss Cooper?
I'm gonna just guess. Is it the transverse abdominis?
Well, I like that you are thinking abdominal. And I do admit the transverse abdominis reaches all the way around back to your back, which is beautiful that you understand that. I love that, and this is an abdominal. It's not the transverse abdominis because it's way too small and it doesn't wrap around to the front. But it is in that area, you're right. The transverse abdominis is in the same area in the back. But it's not, and I know that this isn't quite true, but this muscle almost looks like a rectangle. Almost. It's almost a four-sided object.
Yeah, is it the rectus abdominis?
Rectus abdominis is found in front. This is a four-sided object found in the lumbar region. And there's a reason I called on you.
Oh, the QL?
Yeah, what does QL stand for?
The quadratus lumborum.
And what does quadratus lumborum mean? You're right, by the way. What does quadratus lumborum mean?
It's the deepest abdominal.
It is. It is. But don't. You're regurgitating information to me right now. Answer this question. What do you think quadratus lumborum means? Don't let me stretch you out. It's okay. What is
Divided muscle in the lumbar region.
Yeah! Thank you. Quad means four, dratus means side, lumborum means lumbar region. You rocked it out. Thank you very much. Quadratus lumborum, and you are right. It is the deepest abdominal muscle, and you are absolutely right. The transverse abdominis does go all the way back there. It just wasn't big enough to be the transverse abdominis. But you were in the right track the whole time, and it is an abdominal, and thank you very much. It's been a pleasure. We'll talk to you again soon. Miss Monreal. Miss Monreal.
Yes, sir.
Miss Cooper was just teaching us about the quadratus lumborum, the four-sided abdominal muscle found in the back. What are
Yeah.
the actions that that muscle could perform, the quadratus lumborum, just by looking at it?
It will bring the hip up, hip hiker.
It is a hip hiker, so what do we call that when the hip hikes? Because that's just a nickname for it. No, you're absolutely right. I love that you called it the hip hiker. That's what it is. But what would a hip hike be? What is that action?
Would it elevate the hip?
I guess actually that would be legitimate. Yes, that's probably like a elevation of the hip. Yeah, I'll take that. What's the other thing that you could call that?
Flexion?
What kind of flexion?
Well, is it
We
gonna
talked
be
about these a
working
lot yesterday.
unilaterally?
What?
Is it going to be working unilaterally?
Yeah, let's talk about unilateral right now. So unilateral gives you that hip hike on one side.
Lateral flexion?
Lateral flexion, thank you. Good. Because if it's working bilaterally, what's it going to do?
Just in case you couldn't see my face, it's like blank.
Just in case you can't see my body, I'm doing it.
I couldn't see it. Okay, wait. So it's gonna flex the spine? No, okay, extend.
Oh, God. Woo.
Okay.
Jeez. I'm 51 years old, man. You got to take it easy on me. You need to answer these questions quicker.
No, I hate these. I hate flexion, extension, all of it.
All right, but flex happens in front. This muscle's in back, so yes, extension.
Okay,
Awesome.
okay.
Yeah. Hey, what does the word front start with?
Front?
Yeah.
F?
What does the word flexion start with?
F?
Cool. All right. Just might be a
Okay.
fun way to remember that fun fact.
Yes, I get confused because I think if you're bringing something closer, that's going to be the flexion. If you're making it kind of go away, then that's extension, but it doesn't always apply.
I know.
But that's why I get so confused.
I know.
Anyway.
I know, but you make it fun. Thank you.
Okay.
Okay, Miss Petrie. What muscle is this? And if we need to work...
Is that the serratus anterior?
Well, I like that you're wrong, by the way, I'm sorry.
Oh,
but I like that you said it because serratus anterior does attach to ribs. Serratus anterior has a saw-like look. This has a saw-like look. But it's way too anterior and it doesn't go all the way back to the scapula, so it can't be the serratus anterior. But you're in the right ballpark in that sense of what, like, you're right, they look kind of similar. But this is not in that region. Go ahead.
It looks like an oblique then.
Oh, it does look like an oblique. It's kind of in the abdominal region. It's kind of running diagonal. Okay, so we've narrowed it down that it's an oblique. We just have to figure out, right, if it's internal or external. And the picture won't tell us, like, if they've removed the other one or not. So we don't know if it's the top one or the bottom one. So it's really about fiber direction. Do you remember the thing I showed you with your hands?
Yeah.
So this is external, this is internal. So if this guy took his hands right now, which ones would be following this thing right now?
So that would be the external?
100% correct. Thank you very much, Ms. Petrie. That's exactly the type of thinking I wanted. Great job. It is external, because if he took his hands, they'd be going down like this. That's external. If it was running the other direction, it'd be internal. This is an excellent picture of external obliques. Yeah.
Wait, so internal actually looks like it's running across?
Yeah, so this is external.
What you're saying?
Internal would actually look like it's going this way, the other direction.
Okay.
And they happen to be underneath, but if you take this off, you wouldn't know. But they go the other direction, yeah. So they make a crisscross on the side of your body. It's really smart. That way your body can control the side better.
Okay, so this is
You have,
external. Okay.
you have abdominals that run up and down, side to side, and crisscross.
Yeah.
Yeah, you're all taped up. Very good. Good job. Let me ask you one more question.
Yeah, go for it.
If this muscle works unilaterally, meaning if it only works on one side, if it contracts, what kind of action is it going to create? Remember, it's running diagonal.
Rotation, but I don't think that's right.
Did you say rotation?
I said a medial rotation.
Well, I mean, you can't even call it really. It's just a rotation. But it is, you're right, it's a rotation. No, exactly. It's a rotation. It's a rotation to the opposite side. So the muscle that's working pulls me to the muscle side that's not working. Yeah, rotation opposite side. That was good. That's exactly the type of thinking I want.
It's a rotation to the opposite side.
Yeah, but rotation is fine. It creates a rotation.
Okay.
Yep. And if we want to get really technical, it creates a rotation to the side that's not working, right? Very cool. Very good. By the way, it creates a little bit of a crunch too because it's going diagonal, but we care about it for its rotational ability. But when you're doing crunches, you use all that stuff. So that's good. That's good. Ms. Petrie, just since we're on such a run here together, you and I, what muscle do you suppose this is?
Would that be the internal then?
It is. It's not as clear, but the fibers do go a different direction. He would have to actually take his right hand and put it across to make it go down like that. That's right. So this is the internal obliques.
Can I ask you something though? Does it really have like this, almost like a braid going in front of it?
Oh, no, that's showing that they cut it right there at the abdominal aponeurosis.
Okay.
Yeah.
Okay.
That's where it weaves in the abdominal aponeurosis, and no, there is not a braid there. That's them showing you that they cut the stuff in there. Yeah.
Okay, got it.
No, that's a really good question. By the way, if this one contracts, what does it do?
So if this one contracts, it would also do a rotation, but it would be to the same side?
Yes. 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 So, last question, because you're on fire. You already answered this question, but I want you to put it all together.
Oh, great. Thanks.
So, let's do it with you. When you rotate to your left,
I rotate to my left.
tell me about which internal and which external abdominals you use.
Oh, man. Okay, when I rotate to my left, the internal, but it wouldn't be because
Why not? Which internals though? Your left side or your right side?
it would be on the right side.
You just told me the internals.
But that's what I mean, because the internals go to the same side.
So it'd be the internals on your left side,
Oh, okay.
right?
And then it would be the externals on the right side. Internals on the left, externals on the right when I do a left rotation.
Yeah.
Or rotation to the left.
And I hope everybody's listening right now because I know for a fact that that is a question on the final exam at the end of the entire year, the exam that you can't do open book. I know there's a question about it, abdominal
then
rotation.
when you turn to the right, then it would be the internals on the left and internals on the right, externals on the left.
Yes. Thank you. Thank you. And I saw some people nodding too that kind of get this too. It's very confusing, but the reason I care so much about this particular question is it gets you to start thinking about very complicated actions where you're using two muscles at once, right?
Yes.
And they do run diagonal, by the way. Your body wants to crunch over too. In order to not crunch over, like when I'm turning like this, my spinal erectors are keeping me from crunching over. That's the stuff we don't talk about right now. I have other muscles that are stopping unwanted actions. Otherwise, I would actually rotate and crunch. These muscles actually cause you to rotate and flex because they run diagonal. That's a diagonal action. Cool. Very well done. Thank you, Ms. Petrie. Really enjoyed that conversation. Mr. Kandars. Mr. Kandars, what is this muscle?
It looks like God, and is it deep?
Yeah. No.
Deep to the trapezius, right?
Well, no, it's extremely superficial to the trapezius. It's extreme. I would let the nipples in this picture, by the way, kind of align your orientation
a
little bit.
That's not a back.
That's just a little landmark I use sometimes.
All right. Okay, that's what was confusing me. Yes, that is rectus abdominis.
Oh my God, thank you, sir. I was like, what? What's going on with this guy? Because you're very good at this stuff. That was funny. No wonder you're like, is it a spine? You probably think it was a spinal erector.
Yeah, that's what I was like, what is that?
Yeah. Okay, rectus abdominis is 100% correct, sir. What's the main action of the rectus abdominis?
Basically, like, pull you forward like a crunch.
Yeah, what do you call that?
Would that be flexion of the abdomen?
Yeah, flexion of the spine, but that's fine.
Okay.
Flexion of the spine. Beautiful. And one last question, sir. This muscle essentially attaches your what to your what?
Looks like your sternum to your... Is it pelvis?
Yeah, your sternum to your pubic bone. So your sternum and your first couple of ribs up here, it attaches, ribs like, I don't know what it is, 5, 6, and 7 up here, down to your pubic bone, down that bone right above your reproductive organs, all the way down. And he is right, everybody. All this muscle does, it does not cause me to bend over. It does not flex my hips. It does not cross my hips. It causes me to crunch my spine, to flex my spine. This is the entire movement. 3 inches. Boom. It's a very important 3 inches because it provides back stability. Thank you, sir. That was fun.
Mr. Taxcott?
Yeah.
Okay, so I'm still hung up on flexion and extension. Okay, so flexion front, extension is going to be the back, except for when? The knee, correct?
Wait. Yes, the knee. Just the knee. Just the knee.
And that's it? That's the only time it's not going to apply?
Yeah, that's the only time it's not going to apply.
Okay, I'll try to get that down.
No, it's okay. I think it's really hard. But we've come a long way. I'm not worried at all. Yes, Miss Petrie.
So the rectus abdominis is a flexion of the spine.
That's what I would say.
Because it doesn't actually use the hips.
It attaches to the hips. But when I bend over, I'm bending at my hip joint. This just crosses over my spine joints. I know it's hard to visualize, but it would have to tie down into my legs to pull my whole body over. It's really just attaching to the top and bottom of my spine in a way.
Okay, so it's really meant for a flexion of the spine.
Yeah.
To help with the movement of the spine or protection of spine.
Oh yeah, sure. Movement of spine, protection of spine, spine stability, core strength, balances out the erector spinae and back.
So it really just helps with crunches.
Really helps with crunches, and it really helps with your posture and back strength and all that kind of stuff. It's the thing that gives you strength in the front of your body. Yeah. Okay. By the way, when people talk about core strength, they are definitely talking about all your abdominals for sure. They're talking about some other things too, but definitely about abdominals. If anybody here has done Pilates, a lot of Pilates has a lot of abdominal stuff in it. And there's always some 98-year-old woman laying next to you that can do all the exercises and you can't lift your leg up once.
Can I make a quick comment?
Please.
Well, one, agree with you with that. I was like dying and I'm looking over and there's some old ladies just going hard next to me. But on a serious note, one session fixed the tendonitis in my ankles.
One session of Pilates?
Mm-hmm.
Wow.
She had me doing these super intense hamstring stretches while dorsiflexing and a bunch of other things. And yeah, I had all popping from running track and, just pain from football, my ankles. And someone was like, yeah, I think it was the trainer. She was like, yeah, you probably have tendonitis in your ankles. And, she gave me all these ankle exercises and, it kind of worked, not really, but one session of Pilates, haven't had a problem since.
Yeah. Pilates is neat, everybody, if you ever get a chance to do it. What's neat about it is when you go to the gym, it's always 20 reps of this and all this kind of stuff, right? Pilates, a lot of the exercises, they actually do 4 reps. Slow, 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 slow. Perfect, 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 perfect. And if you've ever tried to do like a crunch really slow, it's really, really hard. They'll have you do leg lifts, all sorts of interesting things. Floor Pilates are really interesting. They also have Pilates machines, but just floor Pilates alone is really interesting. You don't do a lot of anything. You do it really hard, really slow, really perfect. Yes, Miss Petrie.
Oh, nothing. Sorry.
Oh, you just have your hand up. Okay.
Yeah, I'm sorry.
Don't be sorry. I'm teasing. Okay. Miss Melodic. Miss Melodic, what muscle is this?
The external oblique.
Is it running diagonal?
No.
Okay, so can't be an oblique. Can't be an internal or external oblique because it's not running diagonal.
The quadratus lumborum.
It's not in the back. Remember, there's nipples here. It's in the front. That's my joke right now. I'm sorry. But the point is, it is the front of the body. But you're right. That was another abdominal. You're on the right track. You were on the right track. It is an abdominal.
Okay, the transverse abdominal?
Yeah, excellent. And by the way, I'm actually really happy with all your answers because you knew you were in the abdominal region and you're like, it's got to be an abdominal. It's tying the rib cage to the hips. That's what abdominals do.
Well, it's because I've seen pictures where I guess it's maybe the fascia part that was throwing me off. It makes it look so big because it covers so much area. I don't know.
No, you're absolutely right. That's why we had the green pictures yesterday because the body is confusing and we're seeing it in 2 dimensions and here they have the fascia cut out of the center of the stomach here too, and it's very hard to tell what you're looking at. So we're playing a guessing game based on our knowledge of the muscles though, so that's what's really good. Transverse abdominis. Do you remember what the main job of the transverse abdominis is? And you can say it in any words you want, and maybe you don't remember. We don't talk about it very much.
I would guess that it just holds everything together since it's like the top layer. Yeah, and Miss Hunter just kind of typed that in too. Yes, you're essentially right. So thank you, by the way. I actually like your guess, and I like that you're guessing. I want you guys thinking. So the transverse abdominis really acts like a belt. And when you've seen like people in stores with those belts or people in the gym with weightlifting belts, they're just wearing transverse abdominises. So yes, they hold your guts in, Miss Hunter, but they also, the transverse abdominis can lock down like a tight belt around your abdomen for when you have to lift something really heavy. It locks all the other abdominals down. It creates a tight ring around the barrel of your body here, just like they have rings around barrels to hold the staves in, the wooden staves in. That's what the transverse abdominis does. It is a sphincter muscle that's giant and it squeezes down in to hold your contents in and create internal pressure to make your midsection tough so you can pick stuff up. Because you can't have your midsection floppy when you're picking up your child or groceries. The transverse abdominis locks all your other abdominal muscles down. Good. Good thinking, Miss Blodek. Thank you. Anybody know what this muscle is? We haven't covered it yet. I mean, we've talked about it, but it's not in anything yet. I don't know why it's in here, actually.
Sternocleidomastoid?
Yes. What's it named after?
The sternum and the clavicle.
Yep. Sternum, clavicle, and?
The mastoid process.
Beautiful. Thank you. It attaches to the sternum, the clavicle, and the mastoid process of the temporal bone, right? Miss Monreal, what's the other muscle we know about that attaches to the mastoid process of the temporal bone?
Oh, is that the levator? No? What? Oh, gosh. We just talked about it yesterday.
Yeah. I'll give you a long time to think about it.
Oh, longissimus.
Oh gosh, man, that was good.
We talked about it today.
Longissimus, yes. And this muscle pulls your head forward, the longissimus pulls your head back. They can argue together, and they are primary fascial line muscles. Later we're going to get to them. They're really, really important, but they kind of triangulate at your head, and they both can pull on the mastoid process of the temporal bone, which you can all feel on your head. It's this bump back here, kind of behind your ears.
Can you repeat the question that you asked her?
Yeah, I asked her. Well, yeah, I asked her. What I was trying to get at, Miss Petrie, was how many. I'm curious about things that attach to this mastoid process of the temporal bone. The SCM, the sternocleidomastoid, attaches to the sternum, the clavicle, mastoid. Sternocleidomastoid is this muscle in front of your neck that goes like this, like a diagonal. The longissimus also attaches up here from your back. So I was just pointing out the longissimus comes up here, boom, and the sternocleidomastoid comes off here. And they create this triangular process and kind of both can pull down on the head, which can create headaches and all sorts of stuff, but also it just shows this some very important structural muscles to your body, how your body is hooked together. And that's why I'm so into the longissimus from the back side and so into the sternocleidomastoid from the front side. We also know a third muscle that reaches all the way back over and grabs onto here. Does anybody know that muscle that we've already learned that comes up and also reaches all the way over and gets to the mastoid process of the temporal bone? It's a neck muscle.
Is that the levator scapula?
No, they go to the side of the neck. I can understand why you'd say that, but they don't. They go to the side of the neck. They don't get up to the skull. I'm pretty sure, I hope I'm not wrong on this one. The semispinalis capitis. The semispinalis capitis grabs on, I'm right, Ms. Giannis, you looked it up, I hope. You're my fact checker, thank you. It grabs onto the nuchal lines back here, but it goes all the way over to here too. So you got another triangulation. Got another triangulation on that. So we know 3 muscles that now have attachments on this spot here. And you know I'm really into stuff where lots of stuff hooks to it. Because that means it's got lots of things vying for its attention and pulling it around. And rub this area. Tell me it doesn't feel like it's kind of tense. Do you feel that bump there? This feels good. Yeah. Cool. All right. Awesome. I'm watching the time really carefully because I have to get off here soon. But let's see here. Oh, hey, this is important. Just so you know, this is where the carotid artery is. It's the artery that goes up your neck. You don't have to be afraid to push it, but don't push on both sides and hold it down for a really long time because that's how you choke somebody out. But that's where you get a pulse. When you see people in the movies where they're like, and they hold it there for 1 second, and they're like, ah, they're dead. That's not actually how you check. You have to stay there for a while and be like, really? Because some people have a really faint pulse. That's the carotid artery. Okay. Miss Felix Osuna.
Yes.
What muscle is this?
That's a deltoid.
Yeah. What does it share attachments with?
With the traps.
Thank you. The insertions of the traps are the origin of the deltoid, yeah. All the fibers of the deltoid come down and insert into one spot on the humerus. Do you know what that one spot is?
Was it the tuberosity of the deltoid?
Yes, deltoid tuberosity. Tuberosity of the deltoid is completely legitimate. That was beautiful. Thank you. What are the main actions of the deltoid?
Does it help with abducting the arm?
Abducting, absolutely. See, I had to think there for a second. But absolutely, that's probably, in some ways, its main action. It abducts my arm. What else can it do? What can the front fibers do?
Maybe help with rotating?
The front fibers actually do help with a medial rotation. What else can they do?
That's extending?
That's the rear fibers.
Oh, flexion.
Flexion. Anterior fibers, flexion, rear fibers, extension, middle fibers, abduction. Don't get me wrong, there's some overlap there where other fibers help other fibers. Some people argue all the fibers help with abduction, but that's the point. And you were right, by the way, because they're diagonal, the anterior fibers can do a medial rotation And the posterior fibers are diagonal too, and they can help with a lateral rotation. Thank you very much. Cool, cool, cool. Tricky stuff. This is just something good for you guys to know. The space between the deltoid and the pectoralis is called the deltopectoral groove. And when we're trying to loosen people up, we're trying to press right in this groove quite often, this deltopectoral groove. It's not really a groove, it is kind of a groove when you bend their arm, but it's just a spot in the body we talk about, the deltopectoral groove. Miss Stanley, this is half of what muscle?
Trapezius.
Yes, thank you. More trapezius. Miss Nguyen, what is this big red muscle here? Big red muscle on the lateral side of the body and the back. Back and lateral side of the body. It's actually named back lateral, or lateral back actually.
Sorry, sir, in the laterossi.
What?
I think in the laterossi.
I don't know what the laterossi is.
I say in the dorsi and femina.
Oh, wait.
She's saying latissimus dorsi.
You're saying latissimus dorsi?
Yeah.
It is latissimus dorsi, the largest muscle arguably on your upper body. Yeah.
Yeah.
It inserts into your arm. What is its main job? What does it do?
I think it tends
Yeah.
contract and
Yeah.
extends.
Well, they all contract, but it extends the arm and adducts the arm. But everybody, just in your brain, it pulls the arm down. If my arm is up and I want to pull it down, the lats pull it down. If they pull it down in front of me here, it's an extension because my arm's coming back. Extension, and off to the side it's an adduction, but that's it. By the way, it can do a medial rotation too, but the point is it pulls my arm back down to my body. It's a climbing muscle. That's its job, is to help you climb. Very, very cool. Thank you. Latissimus dorsi. Okay. Let's see here. Oh, wow. That one's tricky. Okay, Ms. Torres, let's give you a tricky one. What muscle is this?
I'm thinking teres major because it looks a little bit big.
It looks bigger, and it also goes all the way down to the bottom of the scapula. And the teres major is known for connecting all the way down to the inferior angle. So I think your guess of teres major is an excellent one, and it's a right one too. Good job. That was hard because there's nothing else around it in this picture for you to kind of guess with. By the way, they're just showing you a picture. It's not a great picture of the thoracolumbar aponeurosis because a lot of stuff weaves into it. It would be this entire spot down here. It's the thoracolumbar aponeurosis, and all this stuff kind of weaves down into it. Miss Harper, what two muscles are these?
That's the teres major and minor.
Which one's on top? More superior.
The top is the smaller one is the minor.
Thank you. Good job. Miss Hanson, what muscle is this?
I have to think for a minute. It's the one that goes with the teres minor.
Good. Good. I actually like what's going on in your brain right now. I'm already so happy that you could even mess this up now. I'd still be happy because it does go with the teres minor all day long.
So you have your
supraspinatus, which is up here.
Spinatus, subscapularis, and
Well, if you got a supraspinatus, what means underneath the spine?
that one.
Yeah. Well, if this is a superior position, what's an inferior position?
Infraspinatus.
Thank you very much. Good job. That is my favorite type of thing when you guys just kind of pull something out because then you burn it into your brain. That's really good. Good job. What's the action of the infraspinatus? It does rotate. I don't know why you're doing this stuff, but it rotates, yes. Which way? Laterally or medially?
Laterally.
Thank you. That's exactly right. It laterally rotates my arm because it's behind me. So it rotates my arm laterally. Beautiful. Which, so does the teres minor because they do the same thing. Well done. Really well done. Cool. Miss Cooper. What muscle is this in red down here? Right underneath the infraspinatus. Goes with the infraspinatus. Anytime I say infraspinatus, you say this muscle.
Subscapularis.
Anytime I say infraspinatus, you say subscapularis? Subscapularis is on the other side of the scapula. Underneath it. This is below the infraspinatus, this little red muscle here. You are right, by the way, that you're talking about rotator cuff muscles. Yes. What? Yes, teres minor, yes. Sorry, I got confused.
I want to ask you, I want to tell you, Element already sent email for me.
Oh, good. Element sent email for you. Good.
Yeah, but I want to tell for the Zenny and Hunter know about that.
So, Miss Petrie, Miss Hunter, you should have emails, or you should be getting emails soon right now because they reached out to Miss Nguyen. They just, cool. Good job, Miss Cooper. Thank you, Miss Cooper. Hey, Miss Cooper, what are the name of the 4 rotator cuff muscles?
Shoot.
I don't think that's one. You just said 2 over here. There's 2 on this slide.
Infraspinatus, teres minor, teres major.
Nope.
Oh.
If there's an infraspinatus, what's the one above the spine?
Supraspinatus.
And what's the one?
Okay, well, teres minor. There's also a teres major.
There is. Your logic is excellent, but it's not one of the rotator cuff muscles. So infraspinatus, supraspinatus, teres minor. What's the one underneath the scapula? You already told us it.
Subscapularis.
Good job. Thank you, ma'am. Miss Yanas, I'm calling on you because you made this face, and everybody should be making this face. It's very hard to tell. Don't be thrown off by these little teeth-like projections down here that are not in red. What is this red muscle that we're seeing underneath here?
Is that the subscapularis?
It is all day long. You did a really good job. It's really hard. What they're trying to point out is the subscapularis is actually on the anterior side of the scapula. We just rarely see the anterior side of the scapula. Underneath it is the serratus anterior, and over here are the pec muscles, and back here are the lats. But it is in the armpit in there, basically. And you actually can't open up somebody's arm like that and press down into their scapula, and you're pressing on the subscapularis. Yeah, what's the action of the subscapularis? Ms. Yanas? It's the opposite of the infraspinatus and teres minor because it's in front.
Medially rotate?
Yes. It medially rotates, the other ones laterally rotate. Really good job. Thank you. Really hard question. Miss Hunter, what is this muscle right here?
Supraspinatus.
All day long. Excellent. And what is its main action?
Is that to elevate the shoulder?
Darn close. It is the one rotator cuff muscle that does not rotate anything. Normally elevation is just straight up. This thing brings my arm out, right? So what do we call that?
Oh, abduction.
Abduct.
Of the arm or the shoulder? Or
yeah. So it probably works along with another muscle if it abducts the shoulder. What other muscle might it work along with when I'm abducting?
Deltoid?
Yes. Thank you. By the way, guys, these are the kind of questions where you're starting to advance into advanced anatomy. You're starting to think now. First, we learn like, hey, this muscle does this thing. They never work alone. So the supraspinatus and the middle deltoid for sure work together, if not the whole deltoid, work together to abduct the arm, right? We're starting to put stuff together. Really good job, Miss Hunter. Thank you. Really impressive. Boom. Miss Petrie, what muscle is this?
Is that the teres minor?
It is. Good job. It's not far enough down to be the teres major. It's not high enough up underneath the thing to be the infraspinatus. It is the teres minor. I'm really impressed. Thank you. Really, really good. These are spinal erector muscles again, yeah. Okay. I feel like I just lost somebody. Miss Bilotic, what muscle is this? Or muscles, really. It's two, but they're similar in name.
You said 2 muscles?
It is 2, actually. I mean, they're very similar.
Well, I was gonna say the rhomboids. But
I would go with that. Just add to it. Just say rhomboids.
the rhomboids and then.
No, just like rhomboids bigger and littler.
What?
Rhomboids major and.
Oh, major and minor?
Yeah! Good job. Rhomboids major and minor, but they are the rhomboids together. In fact, look, the slide says you're right. So, rhomboids major and minor, they attach the scapula to the spine, right? Good job. Cool. Miss Monreal, what's the main action of the rhomboids?
To retract the scapula.
Yep, what's the other word for retract?
Adduction.
Yeah, what muscle do they probably work with when they do this? What other muscle does a retraction or an adduction?
Anterior? Or does that fight against it?
Fight against it.
Okay, hang on. Don't rush me. Trapezius.
Trapezius. Middle fibers of the trapezius are probably always working when the rhomboids are working. Well, I don't know that for a fact, but probably 99% of the time. Good. This is the type of thinking I want. This is going really well. There's your rhomboids again. There's your trapezius again. Miss Monreal, since you're on the call here already, what muscle is this?
Levator.
It is levator scapula. It's up there by the superior angle of the trapezius. It inserts into the side of the neck. It does not go all the way to the head. Side of the neck. And what's its main job?
To elevate the scapula.
Elevate the scapula.
And turn, like the head. Flex.
It helps turn the neck a little bit, yeah. A little like neck flexion.
Is that the one where you said, is that the example where you said that if it was a braid?
Yeah,
it
twists a little bit. Oh, I don't remember that actually. I gotta really think about that one. Might turn the same side. I think it would turn the same side. But anyway.
I thought you were, anyway, whatever, I don't want to throw you off.
Yeah, sorry. We'll come back to it.
All good.
You look so funny doing that.
Hey, Miss Torres, what muscle is this?
Where? I can't because you look so funny.
What muscle?
Oh, God.
Miss Torres, what muscle is this?
It's a serratus anterior.
Yeah, perfect. Okay, everybody, I got to take a break and see if my presentation is starting in like 1 minute. I have opened up a discussion
Can you
for
hear me?
Yes, I can. You were right. Serratus anterior is right. I have to open up a discussion for you guys. It's called, it's already open. It's under discussions. It's called Teach Girls Bravery. If I drop off this call, I will come back for you. Okay? It's a very good TED Talk. That doesn't mean you have to like it, by the way. But anyway, thanks for raising your hand. What can the upper fibers do of the pectoralis major?
I'm wondering if it does an abduction of the. Oh, I don't know. I think I lost myself. Never mind.
That's all right. I, again, appreciate you thinking. Everybody, just take your hand like this and do the upper fibers. Grab on your shirt right here. Pull on your arm and see what happens.
But isn't that the medial rotation
Yes, it could be this,
that she was talking about?
but it runs diagonal. So when things run diagonal, they're going to pull this way and that way, right? They're running diagonal. So one of the diagonal things is the medial rotation. What's the other diagonal thing?
flexion?
Flexion of the shoulder. Actually can aid a little bit in flexion of the shoulder. Kind of pull it up like that, yeah. Feel it. Flex your shoulder, bring your arm up to your, like this. You'll feel your upper pec go. Yeah. Let me ask you all this. If my arm is way up like this, can the pec do anything else? Is the pec stretched out here? What happens if it contracts now? It will pull my arm back down. It will help pull my arm back down. I know it's hard to see, but it will. Especially the lower fibers. If my arm is way back here, it'll help me pull my arm back down. What's this called? Dips. If my arm's way up here, it'll help pull my arm back down.
An extension?
Yeah, sorry. You're absolutely right. Extension or adduction. Yes. Thank you for the technical term. You're absolutely right, Ms. Jonas. I forgot to kind of tie it all in there. You're going to say something, Ms.
I'm
Hanson?
sorry, but I thought extension is behind you.
Extension is heading towards behind you. So, like, I'm extending now even though I'm in front. But I'm heading back here, right? Extension is going this direction. Remember we talked about this yesterday. It's not where I'm at. It's the direction I'm heading. Flexion, extension. Yeah, cool. So, let's... Oh, here's pectoralis minor. Beautiful picture. Oh, yeah. What muscle is this? Anybody? Yes, Miss Stanley.
Is it biceps brachia?
Why do you think it's biceps brachia?
Because I see two heads and it's on like that part of the arm that looks like it's the brachia, so...
Yeah, this is kind of like in math class where they're like, we just don't want the right answer, we don't see your work. Thank you for showing us your work. Yeah, it's a two-headed muscle. It is on the brachial region. It is very likely the biceps brachii. Yeah, very good. Biceps brachii. One little head is going over the coracobrachialis. The other one's going all the way up here and inserting into the supraglenoid tubercle up there. Very cool. Okay. So, somebody else, not because I'm not trying to shut you down, Ms. Stanley, just because you answered the last question. Somebody else, what muscle is this? Yes, Ms. Petrie.
Would that be the brachialis?
It would be the brachialis. Yeah. Is it found superior or, I'm sorry, is it found superficial or deep to the biceps brachii?
I want to say it's deeper.
I want you to say it's deeper. How about we say it?
Okay, it's deeper.
Yeah, it's underneath the biceps brachii. You're absolutely right. We don't see it, but it's actually a very powerful muscle that just does one thing all day long, which is what? What does that muscle do, Miss Petrie?
It flexes the elbow.
Yeah. Did you memorize that answer, Miss Petrie?
No.
How did you figure it out?
Because when you contract, your L's hold up your elbow.
Yeah. Huh. Welcome to the world of kinesiology.
Thank you. I finally made it.
You made it way ahead of schedule. This is excellent. This is exactly what we want to see. We did not want you guys memorizing this stuff. We wanted you thinking this way. This is a very happy conclusion to our course, which we're rapidly heading to. Anybody, what muscle is this? Yes, Miss Felix Osuna?
Tricep brachii.
Tricep brachii. Okay. Ms. Torres, tricep brachii, what bone does the long head have an origin on? They all insert into the elbow. They all push my...
Scapula?
Yes! And because the long head actually attaches to the scapula, it doesn't just extend the elbow, it does something else. What's the other thing it can do?
What's the elbow?
It can also help to adduct the arm because it's reaching across to the scapula here, so it can actually help to bring down the arm. So we don't think about it that way normally. Its main job is to push out this thing. But what? What, Miss Torres?
Oh, it brings down the arm?
Yeah, it can also bring down the arm. The long head, just the long head. Boom. Okay. Who can tell me what this muscle is? What, Miss Moria? What?
I was thinking because it was in the back.
Yeah.
So I thought that when you.
Yeah, by the way, Miss Monreal, you're right. And Miss Torres, I think you're talking about the triceps long head. It is in the back, but I just meant it can still bring my arm down. It can also help extend it a little bit. Yeah. Anyway, this is the coracobrachialis. This is your coracoid process. This bump on your scapula that actually pokes out here in front, and it inserts into the arm. What's the action of the coracobrachialis? There are two actions it performs. It's a diagonal muscle right here, like this. What two actions does it perform, Miss Monreal?
Okay, well, I know it immediately does something. So would we say it in reference to the shoulder or to the arm?
Shoulder. Because, yeah, it's the shoulder joint. What?
Immediately rotate?
Yeah, I guess it would medially rotate a little bit. Tell me two other things it does.
I don't know, like I'm thinking of it contracting, I'm just like.
I'm doing it for you now, right now. I'm being the, kind of being the coracobrachialis right here.
Okay, hold on. Let me change my screen. I couldn't see that. Okay. Oh, elevates. It elevates the arm. No.
You don't elevate an arm. You elevate a shoulder. But anyway.
Okay. Just help me out, man.
No, I'm not helping you out because this is the thing you're trying to learn. What happens when I raise my arm in front of my body? What do we call that? Yes!
No!
Flexion! Don't say no, it's flexion!
Okay, yes.
Flexion, front, remember? Flexion, helps with the flexion. What's the other thing it could do?
You're killing me, Small.
What's the, I love that movie, by the way. What is the other thing it can do?
I don't know.
I'm doing it right now. This is my interpretation of the skeleton. The wrist is not important, but that's what the skeleton was doing. It goes from here to here. If my arm is out horizontally and it comes in, what do we call that? What do we call this?
Hello?
Hello. Yes, Miss Monreal, what do we call that? I think maybe you're going in and out. Anybody? What do we call that?
Horizontal abduct?
Horizontal adduction, yes, adduction. So this muscle runs diagonal down like this, so if it pulls, it can kind of pull my arm up. It can also pull my arm in like that. It can also pull my arm diagonally like this, but we would say that that is a combination of a flexion and a horizontal adduction going together. Cool. All right. Good stuff. Anybody tell me what muscle this is in this picture here? You gotta kind of understand all the muscles in the arm to kind of answer this one. It's not the rectus femoris and it's not the transverse abdominis. Nobody?
Can I try?
No. Yes, of course you can. Go ahead.
I'm like between either biceps brachii or brachialis.
Well, which one is it and why?
I think it's biceps brachii.
Why do you say that?
Kind of hard because the way it looks, but it just almost looks like it's one of the heads. But at the same time, I'm looking at how it's attached to the deltoid.
So, but if you're looking from the side, you can't see the two heads. They look like just one muscle from the side. So if that's the case, what muscle is this?
Brachialis.
Brachialis. This is the triceps brachii in back. It's the major part of your arm, guys. This is the deltoid up here. This is your biceps brachii up here. This is the brachialis underneath. That's what it should be. Yeah, good. If I give that big long speech, I'd be wrong. Okay. All right. That's it for that.